Hello and thanks for joining us. My name is Simon Floss with Sanford Health News and the Good Samaritan Society. Joining me all the way from the nation's capital in Washington, D.C. is Nate Schema, the president and CEO of Good Samaritan Society. Nate, I was wondering where you were. I haven't seen you in the gym at work all week. Turns out you're in Washington, D.C. How's it going out there?
We had a few things going on this weekend, Simon, but don't you worry, I'll be back next week.
Can you explain for those who don't know why you're in Washington, D.C., what's going on there? It's for the Congressional Briefing. What is that?
We have an opportunity to shape and influence. The proposed rule is scheduled to be released any day. And based on the latest that we just heard here in the last week or two, we think within the next 10 to 14 days, we could see that staffing rule drop. And then all bets are off, and we're going to need everybody's voice and everybody's hands around the table to shape and influence what that final rule will ultimately look like.
And, why is this so important? Why is this such a big deal?
While we're always staffing to meet our residents' needs, the idea of a proposed minimum staffing mandate without being funded, without the appropriate waivers, could just be absolutely devastating and really be an access issue for us, especially in the upper Midwest. Are we okay with driving an hour for our loved one to receive that much needed care?
What is your hope for the Congressional Briefing?
I think first and foremost, we want our policymakers to hear what this means for us in the upper Midwest. We want them to understand that this is an access issue that is bubbling. And quite frankly, I think it could bubble over if a proposed mandate isn't put together in a very common sense with all of the right pieces, make sure and it's funded. I just can't imagine going and sharing with more of our families that we serve and have the privilege to serve in the upper Midwest that, based on some new rules that the government has put together, you're going to have to drive another hour for care, because that's what's going to happen. It's going to reduce our ability to provide care close to home.
Well, Nate, thank you again so much for taking time out of your busy day. I'm sure there's a lot going on. We really appreciate it.
Appreciate it, Simon.
Thanks again for watching. My name is Simon Floss with Sanford Health News.